United States Surgeon General issued a health advisory today about the risk of marijuana use by young people and women who are pregnant.
Blake Lipton spoke with medical professionals in obstetrics and gynecology to find out how pregnant women who smoke marijuana can impact the health of their babies.
Josh and Sarah, according to the Department of Health and Human Services, marijuana use in pregnant women has nearly doubled in the past 15 years. Between 2002 and 2017, that number grew from 3.4% to 7% of pregnant American women. OB/GYN Howard Harrell says many use it throughout their pregnancy.
Endocannabinoid system is influenced by the two active ingredients of marijuana, THC and CBD, and they can influence how the endocannabinoid in the brain and the nerves in the brain develop.
According to health experts, marijuana use during pregnancy can have adverse outcomes.
Women who smoke marijuana during pregnancy, about half their children have growth restriction, and so that's very significant compared to the general population. And then we assume, at least theoretically based on what happens to young children and adolescents that use marijuana, that the children could have lower IQs or other problems with brain development.
And after birth, THC has been found in breast milk nearly a week after the last use, according to the DHHS.
It appears that the marijuana smoking rate in pregnancy in women in Johnson City seems to be at least 2 to 3 times the national average, so it's a significant problem here.
Dr. Marty Olson says many of his patients believe marijuana helps with nausea and vomiting, but he reminds them that there are other safer and tested ways to treat that. According to the Surgeon General's report, no amount of marijuana use during pregnancy is known to be safe, and more research needs to be done.
Patients who are abusing multiple drugs, marijuana is usually one of them, so that makes it hard to figure out the long-term effects of marijuana because frequently there's other drugs on board too.
Harrell says for most people, quitting THC and CBD products is not too much of a struggle. And while marijuana addiction is fairly uncommon, he does say there are treatment programs available. Blake Lipton, News Channel 11.